Thanks so much, everyone, for joining us today. My name is Amy Anthony. I'm the Communications and Outreach Manager for the Hassenfeld Child Health Innovation Institute. We're really excited to get started. For those of you who are not familiar with the Hassenfeld Institute, just to give you a little background, we are a partnership between the Warren Alpert Medical School of Brown University and Brown School of Public Health. And our mission is to make Rhode Island among the world's healthiest places in the world for children. We focus on many child health issues. We have a particular focus on asthma, autism, and healthy weight, nutrition, and physical fitness. And I'd like to introduce our director, Dr. Patrick Vivier. He is the director of the Hassenfeld Institute. He is also a professor of health services, policy, and practice, and a professor of pediatrics at Brown. And he is director of interdisciplinary programs at Brown School of Public Health. So Patrick, over to you.
Great. Thank you, Amy. This is the third in our series of these webinars. Our first two have focused specifically on COVID, the first one on issues of pregnancy and COVID, the second one on more the pediatric age range. We're pivoting a little bit today in that we are still sticking with COVID and how COVID have affected our lives, particularly routines for children around healthy eating, physical activity, sleep, how that's more challenging in these times with COVID, but can also really welcome to branch from that around these issues more generally. So while there are particular concerns right now of how the pandemic is affecting these things, we know there are general concerns too. So we have an incredible panel and it's your chance to ask questions. So we encourage you to submit questions through the Q&A piece and we'll address them as they come up. So before we get started with the questions, I'll introduce the panel. First, I'll introduce Dr. Elissa Jelalian. She's a professor of psychiatry and human behavior and pediatrics at the Warren Alpert Medical School at Brown University and a senior research scientist at the Miriam Hospital's Weight Control and Diabetes Research Center. She's also one of the leads of the Healthy Weight, Nutrition, and Physical Fitness Initiative of the Hassenfeld Child Health Innovation Institute. Dr. Jelalian's research focuses on the development and implementation of weight control interventions for children and adolescents, as well as dissemination of evidence-based treatment to community settings. She is the recipient of several grants from the National Institute of Health to evaluate weight control interventions for youth with overweight and obesity. Her recent research focuses on interventions to prevent excess weight gain and address overweight and obesity in youth living in low-income settings, with a focus on developing sustainable models embedded within the community. In addition to her focus on healthy weight, nutrition, and fitness, Dr. Jelalian also currently serves as the director of postdoctoral fellowship program with the Clinical Psychology Training Consortium at Brown University. Our other panelists also from the Weight Control and Diabetes Research Center is Dr. Whitney Evans, who's a research scientist at the center at Miriam Hospital, and also an assistant professor of research in the Department of Psychiatry and Human Behavior at the Brown University Warren Alpert Medical School. She's also a leading faculty member in the Healthy Weight, Nutrition, and Physical Fitness Initiative of the Hassenfeld Child Health Innovation Institute. As a nutritional epidemiologist and a registered dietitian, her work focuses on examining the dietary correlates of excess weight gain in children and adolescents. Her current research focuses on how changes in diet and physical activity affect risk of excess summer weight gain, so very relevant to this timing of our session, in youth from low resource urban communities, and how existing resources like summer camp and summer food service program can be leveraged to reduce the risk. So all of that, all the more challenging right now with the COVID impacting our lives. So we have some initial questions to start, but I just strongly encourage you to start putting your questions in and we will address them as they roll in. So Dr. Jelalian, if I can start off with you, what did the COVID-19 pandemic and summer have in common as it relates to their effect on children's diet, physical activity levels, and sleep routines?
Sure. First, I want to thank you for inviting us to be here this afternoon. It's a pleasure, and I'm glad to be able to join you and look forward to a great discussion. As it turns out, there's sort of a key commonality shared by what happens or what has happened during the pandemic and what commonly happens during breaks in routine, like weekends on a small scale and summer on a longer term scale, which is essentially, if you think about a typical school day for kids, there's a wake up time, there's roughly speaking a bedtime, there's some regulation in terms of when meals happen, and some sort of standardized routine opportunities for physical activity. When things like disruptions to those routines happen, like are typical during summer and unexpectedly in the case of COVID-19, all of those routines are disrupted. And there's actually a hypothesis called the structured day hypothesis, which suggests exactly what it sounds like, suggests that having increased structure in the day promotes healthy routines as relates to diet, physical activity, and sleep, and that the absence of those things is disruptive. And while there's been much less research in the context of COVID-19, because that's just upon us, there's been a good body of research, as Dr. Evans can speak to, within the summers, showing that particularly among kids living in low resource communities, the absence of the routine, we typically think of summer as being a wonderfully relaxing time for kids when they're out and, having fun. But it turns out it can be those things. And at the same time, it can be a risk in terms of dysregulated eating activity and sleep behaviors, which can contribute to excess weight gain.
And assume that's made much worse this summer with everything that's happening in COVID.
Correct. We would anticipate that because some of the kinds of activities that may commonly be available to kids may not be available in the same way. Absolutely.
And Dr. Evans, can you talk about the importance of routines for children and their families?
Sure. So just to build on what Dr. Jelalian said, we know for a fact that during the summer, or we shouldn't say we know for a fact, but research supports that during the summer, children lose a lot of the physical fitness gains that they establish during the school year. So if a child ends the school year with a certain level of respiratory fitness, and it's retested again at the end of the summer, just as they're about to start school again, they've experienced some reduction in their respiratory fitness. We also know that from the change of loss of the school day, that children who rely on things like this, the school meal program, or kids who would maybe like to snack all day long, aren't able to do so when they're at school. And then when they get into the summer setting, there's less routine involved. And so when we have less routine, there's more exposure to what we call obesogenic behaviors. So we know that in terms of being physically active, children who don't have structured opportunities to be physically active during the summer oftentimes will again become less fitness, when they don't have access to routine meals or snack times like they would during the school year. They tend to eat foods that are lower in diet quality and oftentimes higher in calories. And a perfect example of that, or some really strong evidence of that, is looking at the difference between our diet on a weekday versus a weekend. So we look at, how many times we eat during the day on a weekday, and it's oftentimes limited, whether you're a parent or a child. I know if I'm in the office, I'm going to be stuck with whatever food I brought with me that day, or whatever food I'm going to walk out and get. Whereas if I'm at home, all I have to do is go down to the kitchen and, I have access to snack foods and unlimited calorie intake. So that lack of structure affects all of us. And then as it relates to sleep, there's a lot of evidence to suggest that as sleep times either extend longer and longer or are reduced in either direction, that affects our weight-related behaviors, such as physical activity and diet. And so in all three behaviors, we see this trajectory during these less structured, less routine, less scheduled times to engage in more obesogenic behaviors and to essentially put ourselves at risk for excess weight gain. And again, that's not just true of children, but it's true of all of us. And I think any parent on this webinar can speak to the fact that that's probably happened in their own homes through the COVID pandemic. And then now that summer has started and many people's summer plans have been disrupted because of the pandemic.
So let's start to address kind of each one of these. If I can go back to Dr. Jelalian, can we start off with physical activity? You know, in terms of how can families help their children stay physically active this summer while still being safe? And what are the resources out there that you'd be comfortable sending folks, taking advantage of, or sending to camps, or what can parents do?
Sure. I guess as a starting point, I want to sort of anchor people in what are the guidelines related to physical activity. So for kids, the recommendation is that kids and teens be active for a minimum of 60 minutes a day. And along with physical activity, that they engage in no more than 2 hours of screen time per day. So that doesn't mean that you know, the hour of physical activity needs to be consecutive, you know, working out, but accumulated bouts throughout the day. So I think it's good to start there, so people have kind of a reference point of what ought to be the goal, ideally. And we know, again, we don't have data on children, but we certainly know from data with adults actually during the pandemic that physical activity has decreased and sedentary behavior has increased. So common for people to be spending more time in screens or on screens and doing less in the way of physical activity. I think now that the weather has improved, you know, being Rhode Island specific here, it does hopefully open up some opportunities for people that maybe they were a little less comfortable doing before. So, I mean, there are simple things that families can do, like walking, riding bicycles as a family, to the extent that people feel comfortable doing that, and going outside is an option. I think sometimes people get a little bogged down, especially adults, in thinking they have to do a specific routine or they have to stick to sort of the same thing each day. I think that's not true, and I think often the best physical activity is the one that you're actually willing to do. And making it enjoyable, fun, something that everyone can do together is more likely going to entrain a continued routine and habit. So starting with small amounts of activity each day is fine, and building up and you know, accumulating bouts when you can. I think a lot of resources, or a lot of organizations, have now put out some resources that are available for free to families where, you know, maybe going outside is not an option. Perhaps you're in a small space. You know, the YMCA has some options. Actually, they have a number of things. Your Y at Home for Kids and Families, I believe, is the link, where they actually have some suggestions for physical activity, but also for arts and crafts projects and other kinds of things that, while not physical activity, can displace some of the other screen time behaviors. There are also a number of resources on YouTube. Like, if people may have looked at something like Pop Sugar Fitness, there are some really cool dance routines on there, and they're fun. And I think the point is to really try to make this as enjoyable as possible, and try to build it in as, you know, if not a daily part of the routine, at least something that you're trying to incorporate most days of the week.
Terrific. And a reminder for folks, we do record these. And so if there was some great advice of very specific programs there, you'll be able to listen again. And we'll also ask that maybe Amy can see if we can get links from Dr. Jelalian and see if we can post some of those on the Hassenfeld website so that people
Sure. I know Dr. Evans will reference some resources as well, knowing her. And so I think we could send you all of those, and to the extent useful to people, happy to make that available.
Great.
So bouncing around a little bit, but I want to make sure we're getting the questions as they're coming in. The first question has a very specific question about sleep patterns and napping. Before I sort of read that very specific one, Dr. Jelalian, can you talk a little bit about sleep schedules under this, this double piece of the COVID and all the life changes there, as well as it's now summertime where it can be a challenge. If you can start talking about that a little bit, I'll then read the very specific question that one of the participants has.
Okay, sure. So I think we all appreciate the importance of sleep in regulating many things in terms of, but I'll just give it a plug and a shout out anyhow. So, I think sleep is incredibly helpful in mood regulation, in helping with memory, cognition, and just making people a little bit easier to deal with on a day-to-day basis. So as we talked about from the beginning, without having a specific wake time. So if you think about school or daycare, childcare, many times people are trying to get to a certain place by a certain hour, and that sort of forces a set wake time. Without a set wake time, the bedtime also gets disrupted, and you sort of get into this cycle where both sleep and wake times are largely dysregulated. And there are a couple of things. I know the question is specifically to a toddler, so we'll come back to that. But for school-age children and teens, lots of times the disruptions are not having a set wake time. In addition to that, on the evening or nighttime side, lots of screen time. So, lots of times people are on their phones, in their bedrooms, and it's easy for that kind of behavior to go unchecked, because as a parent, it's hard to know kind of what's happening there. So I think one of the places to start, at least for school-age kids and teens who have access to phones, is to try to cut back on screen time. Try to keep them out of the bedroom. There are apps now that you can load on that sort of either track and or automatically disconnect after a certain period of time or after a set time of day, to try to curtail that. Having a bedtime routine that may involve, for younger kids, and people may already be doing this, but for younger kids, reading, some kind of quiet activity that sort of is encouraging relaxation. Sometimes people do brief meditations, and maybe we can come back to that. And I think the other thing, as I've sort of been alluding to, is having a regular wake time can be hugely helpful. And along with the wake time, having a routine that people are doing in the morning. So even if even if kids didn't thinking about, summer at this point, even if kids are not having to be someplace by a certain time, to try to institute a routine in your house where people are up and eating breakfast by a certain time. They're getting good, making sure people are getting light, getting dressed. I know it's easy to fall back into the, I don't have to get dressed, so, I'm going to lounge around in PJs until noontime, which may be just fine. But I think day after day after day, it sort of keeps us in that routine. And then, it doesn't push us to engage and be awake and alert. So I think the more, the common theme here is going to be routine throughout all of these behaviors. But I think the more you can sort of set a wake time, reduce screen time, and have a routine in the morning that includes a regular ritual like breakfast, getting dressed, and lots of natural light.
Great. So the specific question I'll get to, because I think it's sort of exactly why we wanted to do this session in terms of the disruption of routine. So what was written in is they have an almost 2-year-old son who used to be a great napper. Once the surge sort of came in and life was disrupted, started refusing the naps, and really were not able to get back to them, and was showing signs of real exhaustion. So then when the child started going back with the grandparents, went back to napping there, and that seems to be fine there, but at home is now out of this routine and really doesn't nap unless they take for a car ride and then put down. And they've been trying to follow the same routines, the grandparents and the parents, but the child's routine of napping or not napping is not consistent. Any advice specifically for this family, but also sort of more generally about the issue of routines and napping when it has to be done at different places when children are just a couple of years old and have other caretakers?
Right, that's a great question. I will do my best, acknowledging that we may, phone a friend at some point in terms of a colleague who's a sleep specialist and does more work with younger children. I think obviously what you're already trying to do is terrific in terms of keeping the routine. You're doing exactly what we just said, which is to try to keep the routine the same. I would be speculating. I would wonder if there are other things that are engaging, interactive, like siblings or other fun things to do perhaps at home that maybe aren't as accessible at grandparents' home that might be, interesting and keeping a child engaged. I know the other thing is it's difficult to, and boy, I'm going way back to remember my own experience here, but it's really also difficult to let your child just stay in the room, even if not napping, depending on what he or she does. But I guess I would encourage to keep trying to entrain that routine and not give up, just even though you may have been trying it a bit, but to make sure, the basic things that you were probably already doing, make sure it's quiet and the room is, well moderated in terms of temperature and light and all those things. And even, I would say, even if your child is not napping, to maybe maintain the structure of that timing so that they're at least having some quiet time or, time. It will help to encourage that versus if they're not immediately sleeping or if they're, going to get them and having them engage in some activity, because kids will typically choose an activity versus, sleep in that kind of context. I don't know, Dr. Evans, if you have other thoughts, I'd love to hear.
The only thought that I really have is that, my kids are a little older, but my son is 5, so that wasn't so long ago. And when we would go on vacation, it was a similar thing. His nap would disappear entirely because my husband and I were both all of a sudden available all day, and he was excited that we were. Yeah. And I think Dr. Jelalian's point about maintaining that routine as much as you can and setting a time limit for yourself. So saying if he or she doesn't fall asleep, he or she has to stay in crib for 1 hour minimum. If they sleep, it's sort of like the idea, you wouldn't let them nap too long, so you don't want them to be in their crib for too short of a time. And then the other thing that I learned sort of because I have 2 terrible sleepers is not to go back in. So once you have said good night or, told your child that it's time to take a nap, let them cry, but try your very best not to go in. And so sometimes that would require me to take a walk around the block and to leave my husband at home with my children because he has a much thicker skin when it comes to hearing children cry. So they require earplugs or headphones or, noise canceling headphones, something, but I would stick to that routine as best you can and set limits for yourself so that you're not doing him or her any harm, but they're getting that quiet rest.
I think the idea of having a parameter around that, so I think that can be really reassuring to appreciate, okay, I'm going to do this for an hour, so that hopefully that gives you some context for feeling like, okay, this is not an endless process here. It's great.
So now we'll pivot to a food question as the questions are coming in, and I'll ask you to do this, Dr. Evans. This is from a teenager who's participating and enjoys, as many of us do, food that might not be extremely healthy, but makes the mood happier. And especially in this time where it can be difficult to find happiness in other aspects of life, how do you balance that eating for happiness versus eating for nutrition? I think we all struggle with that any day of the week. But particularly now when some of those other activities that can bring us joy are much harder to access. Can you talk a bit about that and give some advice?
Yeah, it's a great question. So one of the points that I really wanted to make in this talk was the importance of creating routines for our eating habits, just like Dr. Jelalian was saying, for sleep habits. And it's tough to do, especially when you're used to being out of the house at school during the day, and then all of a sudden you're home and can really eat whenever you want to. And so the one thing I would suggest is that try to stick to a routine of meals and having meals and snacks at designated times. So just like we want to set times for bed and wake times, at least on the weekdays, it's helpful to try to stick to regular meals. So having breakfast in the morning, if you're used to having a morning or an afternoon snack, because, you know, when you get home from school or because there's one built into your school day, keep those up if needed, and have a regular lunchtime and a regular dinner time, knowing that in the summer, there's going to be maybe a little bit less adherence to an exact clock time, but just making sure that those meals happen and that they happen in a way that isn't too late in the evening, and also sort of starts your day. We know that sticking to a routine and having breakfast every day is a great way in which to turn on our metabolism and to help our bodies actually sync our clocks, if you will, the clocks that are regulated by light and dark cycles, with our metabolism. And so when we have that first meal of the day, that tells our body and our metabolism time to wake up, and we actually burn fat more efficiently in the earlier parts of the day than we do later at night. And so we want to try to sort of eat more of our calories in the beginning part of the day, and then try not to eat too late at night, because eating late at night can disrupt our sleep and also negatively impact our metabolism. And so if we're able to stick to a routine and eating at designated times, that can often help because it will limit eating in response to emotion. And so I gave a talk, a similar talk earlier in May, and we talked a lot about ways to sort of protect our collective waistline during COVID. And one of those things was how to curb emotional eating. And so I think, you know, I don't think there's a human out there who wouldn't say that they derive pleasure from food. We know that food is stimulating parts of our brain that are reward pathways. And so I would never suggest that anyone cut out foods that do make them happy. But I think it's important to understand why you're eating, and if you're eating out of boredom and then seeking foods that are, you know, that are pleasurable, or if you're eating and including those foods as part of routine snack and meal times. So there are some questions that you can kind of ask yourself to identify that. And so one would be, why are you eating? Are you really hungry? So doing a hunger check. And if you do a quick search on the internet of a hunger and fullness scale, there are some good questions that you can ask yourself to really see, am I eating because I'm physically not hungry, but I'm bored? Or am I am I starving and really, you know, ready to eat? The other way is to sort of understand, are you eating in response to stress or negative emotions? So are you stressed about something that's going on in your house? Are you, depressed or sad about the fact that you're not able to be with friends more often, or that you missed out on something important that was part of the school year, or that you're going to miss out on something important as part of the school year? And if that's the case, trying to figure out other behaviors to engage in to address that stress or those negative emotions. Things like calling a friend, talking to a parent, journaling, reading a book. If it's not so much negative emotion, but something you could just work through on your own, painting your nails is a good way to sort of keep yourself busy, playing a board game or cards. We also suggest keeping tempting foods out of the house. So if there's a food that gives you pleasure, but you know you really can't say no to it, regardless if you're hungry or full, if it's a mealtime or not, have it only when you leave the house. So for example, some people can't say no to ice cream. They bring a pint of Ben & Jerry's into their house and it's going to be gone in that first sitting. And so instead, just say, you know what, I'm not going to keep Ben & Jerry's in the house, but instead I'm going to allow myself one, trip to Ben & Jerry's store or to the local ice cream store every week, or every, twice a week. And that way you can sort of have those special occasions be special occasions and derive happiness from them in a way that's meant to be. And then the other suggestion is really to think about eating with others and enjoying meal times in the way that we want them to be enjoyed. So if you're constantly eating by yourself, meals can get pretty drab, and then we're going to start to think about, you know, what are ways I can garner some happiness out of this meal, and maybe turning to some foods that are higher in sugar or fat that derive those pleasurable feelings are going to be foods that you turn to more likely. So is there a family member or a friend you can eat with? And, you know, being aware while you're eating of what you're eating, so not being distracted by phones. These are all ways to kind of think about ways to engage with food in a healthy manner and to try to reduce eating in response to emotions. So I hope that answered the question. Dr. Jelalian, I don't know if you have any additional thoughts there.
I don't, that was an incredibly comprehensive response. So I think what I'd love to do though is highlight a few things that I heard from you. And I think, which is that, you know, no one would ever suggest, oh, you don't eat a particular kind of food or do eat, you know, we all recognize that. I heard that the timing can make a difference. So even if you didn't change anything, to be on a routine about the what, sort of the how and the when can make a big difference in terms of being more scheduled, and then, you know, stopping eating by a certain time of the day. And then to really take, I think sometimes, and I will speak for myself, sometimes you may have heard, or people may have heard, because there's been a lot of publicity about sort of mindful eating, which, you know, briefly wanting to make sure that when you are eating something that you like and that tastes good, that you're truly enjoying it. You know, and Dr. Evans' point about being with other people. So really taking the time to enjoy the food and appreciating it in full. And also, I guess I would always encourage to think about, are there other things that are enjoyable, whether it's music or some of the things that were suggested. So I think that was an incredibly comprehensive response. I just wanted to highlight a few of the things.
Well, somewhat on the same light, but different topic, we're switching over to screen time is the next question. But similar in that, you know, how do I limit screen time when it's the only thing my child enjoys during COVID? And that, you know, in particular video games, since that can then be a behavioral issue when you are trying to limit it, of the overreaction to limits being set. So it is somewhat similar to the last question of this is a place to go for pleasure, but how do you stick to a routine? So do either of our panelists sort of have thoughts about this? How do you limit that screen time in general and video games specifically?
I mean, I'm happy to start, and then I'm sure I can have backup. So, I mean, I think the first thing I would think about is where you're starting from. So I just spent some time with my nephew, who, if left to his own devices, would probably be on a phone, you know, or playing video games 8 hours of the day. And so I wouldn't, if I were his parent and we're going to start trying to cut that back, I wouldn't say, okay, from now on, you have 10 minutes of video time a day, right? Because that's dramatic. So I think it's important to start with where you are or where your child is in terms of what they're currently doing, and thinking about cutting back from there. So, you know, if someone is on a device X number of hours per day, to think about, you know, gradually cutting back until, so it might be a couple of weeks or more than that to get to a place that feels a little bit more reasonable. I think the other thing to think about, and I know it's a common theme with the last question, is what are the other things that are going to displace that screen time and sedentary behavior that may have a chance of you know, competing with that in terms of enjoyment. And I think, I think it's reasonable to ask kids to even, have a list of alternative activities, be they individual activities or family activities that perhaps someone can choose from, and say, all right, we're going to work on this. We're going to try to, we're going to work on gradually cutting this time back. Let's find some other things that you can do that would be fun. So maybe you can select from this menu of other activities so that you're not just taking something away, there's also a replacement of something that's positive. And then I know not all parents agree with this, but as a behavioral psychologist by training, I think it's also always important to reinforce positive movement, and whether that be in praise, and for young kids and school-age kids, praise, probably even for adolescents, praise is one of the most valuable things that we can offer. So when kids are able to limit, even if it's just a little bit, really making sure that we pause and praise that and acknowledge that behavior. And there's a construct that I've been sort of alluding to, but called shaping, basically, where you're not going to go from, here to here in one movement. So the expectation, I think it's important to have expectations where you appreciate that this is something that's going to be a gradual change, and that steps in that direction ought to be acknowledged and praised in kids. I think sometimes we set expectations really high, and then takes a while to get there, and kids can get discouraged because their small steps may not be acknowledged.
Dr. Evans, do you have anything to add to that?
I think Dr. Jelalian did a great job. I think the only thing I would suggest is maybe sitting down with your teen to try to troubleshoot or brainstorm with him or her around what other activities they would find acceptable. So giving them some say in what's going to happen to replace the video game time or the screen time, so that you're not picking activities that are not necessarily painful for them to engage in, but that they're going to negatively react to and then push back. So to the point where, life is miserable for all parties involved.
Yeah, and actually related to that, the point that you're raising about choice. So, to the extent that it's reasonable, you may, if you decide this is the amount of time you're going to limit to, you may offer a choice as to when your child has access, as opposed to saying, you're going to do it at this time or that time. So the more choice you can offer within the parameters of the goal you're going for, the better received typically.
So related to screen time, a question is, does what counts as screen time? And specifically, does reading on a Kindle count as screen time, both in general, but also specifically as part of a bed routine where we may recommend reading?
Right.
Is that impacted at all if that reading is on a Kindle or a device like that as opposed to a book? And any thoughts about that?
That's a great question. I personally, there might be other people who would disagree with me, but I would not count reading on a Kindle as screen time.
So I think one of the best things about a Kindle or any Apple devices is that you can take the blue light off. And as it relates to sleep patterns, the problem with screens is that the blue lights that they emit, whether it's a TV screen, a computer screen, or your smartphone screen, they emit a blue light that stimulates those light and dark cycles that I was talking about earlier, and tells your brain that's time to be awake. So if you're sending those signals in through your eyes to your brain, and you're telling the brain, blue light is in front of us, stay awake, stay engaged, that the onset of sleep or the production of melatonin, which allows our bodies to relax, and then eventually the sleep pressure will actually help us fall asleep, will not happen. And so with a Kindle and with Apple devices, the Kindle can be put into a mode that is that light background, so it's not blue light. And I know that you can do the same with the more recent Apple devices, is turn off the blue light when you're reading. That said, I would not suggest watching videos or anything that's interactive. I think reading is a different behavior in and of itself, and is oftentimes part of a good bedtime routine.
Great. So sticking with this issue of routine, and something that I think most parents are struggling with now that they are trying to get work done at home, that the home has become the office. for parents. What do you have suggestions in terms of keeping kids busy and ways to try to take up that time when the parent might not be able to be directly involved in the activity because they need to be working? I don't know who'd like to go first for that one.
So Dr. Vivier, if you have any magic bullets, you can.
Yeah, no kidding.
But, you know, as a parent to a 5 and a 9-year-old, I have been exceedingly aware of how difficult it is to keep kids active and engaged in behaviors other than screen time, you know, since March. You know, our kids were engaging in Zooms. They were utilizing their computers. They were doing the majority of their schoolwork over computers. And for kids who are, you know, not of school age, like my son who was in preschool, you know, there weren't even computer activities to engage him in. So I think the idea is that we have to come up with things that are safe, things that we can do in the context of our home or our yards or whatever space we have where we can keep an eye on our kids and feel comfortable that they are safe and in an environment where we don't have to worry about any sort of physical harm. I know that a lot of camps have provided virtual programming for the summer. So I know that you can, and I can provide some of these resources to Amy after the talk, but that there are several camps nationally where you can, if you have a child who's particularly interested in, let's say, arts and crafts or computer programming or typing or computer science, things that sort of can be done remotely. I also know that many different soccer programs, for example, have put together coaching demonstrations, and those can be done in the context of a living room. You may have to move some furniture out of the way, but they could be done indoors if there's not a safe place to play outside or in a bedroom, for example. And so a lot of those online resources are available. And I know we think about that as screen time, but one of the things that I do want to say is that there is such a thing as active screen time. So if you have a child who is engaging in an arts and crafts project and has a computer screen open to his or her right, that's helping to navigate that. We don't think of that screen time as obesogenic in the same way we do a child sitting in front of a television or playing a video game. And the reason for that is that typically when a child is interactive, whether it's, you know, with a live tutorial or a recorded one, they're not going to be snacking. They're not going to be sedentary. Their mind is going to be engaged. And therefore, the sort of obesogenic behaviors that oftentimes come with screen time, like snacking, aren't typical. So I think that it's sort of the balance there. And then the second recommendation would be the one that I gave earlier about sort of engaging your children and asking them what they would like to do and trying to come up with maybe projects for the summer, like creating a scrapbook of what it was like to live in COVID-19 times, or writing letters to family or friends who don't live close by, engaging them in some of the things that perhaps you did as a child that are sort of lost now in this sort of technical world.
Yeah, I was thinking very much along the same lines of sort of setting up a plan for the week, not getting overly burdened in, you know, in the details of this, but in general, thinking about setting up a plan of activities for the week. And allowing your kids some voice in what that looks like, you know, so maybe everybody gets to choose a couple of different activities that they really want to do. And that way you make sure you have whatever, you know, the resources, if it's a virtual camp, if you need particular resources to be able, for kids to be able to do that, like, you know, construction paper, or whatever it is, that you kind of lay that out ahead so that it a little bit, that structure is there for you as you go into the week. It doesn't mean it's going to be flawed, you know, there will be some bumps, and kids are always going to find where their parents are in terms of, you know, when they're working at home. But I think if you have also perhaps some set check-in time, so depending on the age of your kids, it's hard for kids to go 3 hours and, you know, be independently working on something. So, you know, a 2 or 3 minute check-in you know, each hour may end up saving time over the course of a day versus, you know, some disruptions that happen at the worst possible time when, you know, when you're in the middle of the most important meeting or most important thing you're trying to do during the day. So I think the more you can, I know it's another thing to plan for, which sounds burdensome, but perhaps it can be fun in terms of having kids think about things that they want to learn more about or get to know more about or spend time doing. And you get to plan that out together with them a bit.
One of the things that I think is, I think of when I'm sort of reading that last question, there's not only the how do you have activities for the kids while I'm trying to work. Can you talk a bit about how families deal with the stress of that? You know, that it is sort of that double whammy of trying to figure out for oneself as a parent how to keep getting your work done while you're also worried about your children's activities. Do you have any suggestions of how to manage that stress for the parent?
That's a great question, Dr. Vivier. I think one of the things that's really important, so, I mean, parents are doing an incredible amount, and I think the first thing, it probably sounds obvious, but is to really acknowledge all the work that parents are currently doing. So if you think about wearing the hat of parent or caregiver plus teacher plus now camp director while maintaining a job, I mean, that's tremendous. So I think it's important first to recognize all of that and to cut a little bit of slack you know, around what your expectations are for how well all of that's going to go. So I think that's an important first step in just, you know, recognizing how much is doable under the constraints that we're all currently functioning under. And I think related to that is it's a very simple sort of thing, is recognizing what you can and cannot control. And appreciating that distinction and sort of obviously, you know, not trying to control the things that you really cannot. I think, you know, we've talked about physical activity in kids. Physical activity with adults is an incredible mood regulator. Lots of research supporting improved mood with participation in physical activity. So I think that's always helpful. I think there are some more structured things that people can do, like progressive muscle relaxation, for example, or even some more focused mindfulness activities. And these don't have to be lengthy sort of things. I mean, you can do progressive muscle relaxation in like 5 minutes. Where you successively go through different muscle groups of your body and tense and relax them and sort of pay more attention to the state of relaxation while you're doing that. There's also a huge emphasis right now on mindfulness and meditation and the therapeutic benefits of that for everybody. And there are actually some there's an app called Smiling Mind that's a free meditation app. It's geared towards kids and adults. And there's also an app, I think it's without cost, called Headspace that, you know, can take you through some more structured breathing activities. It's also something that's great to model actually for kids. So I think doing it together as an activity and helping, I think it's okay for children to realize that parents have times when they're a little bit more stressed, and that more importantly, that they have adaptive ways of coping with that. And so I think modeling some of that can be really helpful for kids as well.
Great. And I'll emphasize again, Amy will work with Dr. Evans and Dr. Jelalian to make sure we get some links and other information on our website once this recorded session is up. I want to be mindful of time. We have about 10 minutes left, and there's still a number of questions to go through.
Okay.
So I want to see if we can do some of them quickly. The next one is from a teenager, again, around this issue of routines, that the routine environment to get schoolwork done was in school, you know, and that was a place to try to do work there. that home was a bit more comfortable, and really, advice, just like it was Dr. Evans talked earlier of eating routines and how to keep those routines similar to when you had that structure of going to work or places. Any advice around staying productive from a schoolwork perspective when you can't be in that school environment? Either of you want to take that one?
Well, one of the things that I was going to say, and sort of in response to what Dr. Jelalian just shared, and then in response to several of these questions, is just really the importance of planning or scheduling. So in order to maintain a routine or do things, is one of the things that we can do to help ourselves is to plan ahead. And so I think whether you're a parent dealing with multiple demands on your time, or a teenager who's trying to think through how they can actually structure their day, planning and scheduling can oftentimes help with that. So if you say every single day from 10 to 11, I'm going to set that aside as studying time, it's much easier to stick to that, because then you can allow for other things to happen that may be either disruptions or distractors for you, like time with your friends, or time on your phone, or whatever it is that makes you happy. It's also true for physical activity. If you plan for physical activity and you carve out specific time for it, it's much more likely to happen than if you just wake up and say, well, I'll work out whenever the time comes, or whenever I have a minute today. I know as a parent, if I don't schedule time for myself to work out, then sometimes it's 5 o'clock and time to start making dinner, and I'm still wearing my running clothes. I think Dr. Jelalian can attest to that.
She has very nice running clothes, but
I think that planning is really important, in trying to think through for yourself what's realistic, what would I be willing to do with respect to studying or exercise, and then trying to execute that. And I think also sometimes having a partner doing it with you, or someone who you can be accountable to. So if you are someone who doesn't necessarily like to study, but you need to, see if there's a classmate or a friend that you can set up a FaceTime date with, or a Zoom call with, and set that time aside so the two of you can do schoolwork together, even if it's virtually and you can't be in the same place.
I think that's great. I also want to commend you, obviously, on your efforts here and your investment in continuing to want to be productive, and your motivation for doing that is terrific. I think the only other thing I would add is thinking about a space, because I think we have a lot of cues. There are a lot of environmental cues. Like in school, you have the things that you associate with learning. So I know it can be hard in homes, you're sharing space with everybody else, but if there's a small corner that you can sort of co-opt as your space for doing work, and sort of you appreciate that, okay, it's my hour, I'm going to this space to do work. I think the more routine, we are saying the same thing, and the more, even having a space to do that. And I will say, one of my colleagues told me at the beginning of this that she took a walk, like a mile walk around her neighborhood to establish a commute in the morning, so that she had some specific marker for that's when her workday started. So that's what she was doing for herself. I think we all find our own ways of doing this, but I think, all of that is helpful.
Great. So we'll switch gears to another screen time question of the challenge as a parent, that the screen time can also be the social time, that they're playing video games and are able to talk with their friends, even if they can't be in the same room, or they're texting and on phones. And how do you balance that of some of the, as the parent said, the mindfulness, the mindless sort of surfing versus this is the way to communicate, this is the way to stay social? And any thoughts about balancing that in trying to restrict screen time?
I think when you're talking about adolescence and you're talking about phones, it just is really impossible to try to, distinguish or restrict one kind of time versus another. And as you're saying, that is the current mode of interacting, and you wouldn't want to have kids, totally appreciate you're not wanting to disrupt kids' connections with their peers. I think, I don't know how I feel about this. I mean, I think there are ways of apps within phones where you can track usage. and different kinds of phone usage. So the extent to which people are texting versus looking online versus, you know, I don't know. I feel a little bit mixed, honestly, about doing something like that. I think that's only as a collaborative effort with your teen if they are interested in doing that. I think other than that, sort of talking with kids about, you know, having a turn off time. And I would really focus on the bedtime and the sleep and the disruption to that probably over the overall amount during the day. As I think that's just a little bit tough. I appreciate the challenge. And I think especially now it's a little bit tougher to navigate that. I don't know, Dr. Evans, if you have other thoughts about that.
Unfortunately, I don't know that I do. I'm not sure that there's any evidence about, you know, how you would go about doing that in the best way possible. But I think open communication is probably the best way to go about it, and trying to think about setting limits for overall screen time, and thinking back to the conversation or the suggestion earlier of, you know, displacing that type of time with other activities. So if social distancing isn't, or excuse me, if social distancing isn't possible and kids are only able to communicate via phone, we don't want to take that social time away from them, but also trying to think about, well, how could I facilitate my child seeing this friend of theirs in person? Could it be through a bike ride? Could it be through, you know, having that teen over and sitting outside in our front yard, or going to a public park and sitting, you know, on 2 separate blankets, 6 to 12 feet apart? I mean, I think now that we're trying, you know, we've learned a little bit more about COVID. We do know that we can relax some restrictions outdoors and in spaces where we can be safe. So perhaps trying to think about ways to allow some of those behaviors to take place again.
Yeah, and I guess I would also look at to what extent are there other concerns associated with the phone use? So there may be kids who are spending time on phones, but they're appropriately engaging with peers. They're, you know, sleeping reasonably. They're engaged with family. And that to me looks different than a teen who is, you know, sheltered in their room all the time, not very interactive, staying up all hours, you know. So in both cases, you'd have a lot of phone use, but the other behaviors that were going alongside that would differ quite a bit. And I think my response would, you know, to how to handle that would also do. I think in an otherwise engaged, interactive teen who's, you know, staying connected, I would probably focus on the disruption to sleep to the extent that that's happening, at least for now.
Terrific. Well, I want to finish up with a couple of dietary, diet-related questions, because we really only have a couple minutes left in this hour. But I also want to let folks know who are participants, our website has a family resources section. We will add stuff from today to that. Already there is a subscription to handouts from the American Academy of Pediatrics. And if you come to our site first, it will authenticate you because we pay the subscription, and you'll be able to get free handouts on a broad range of topics, including ones that were brought up in this session. So I'd really encourage you to come to our website. To finish up with dietary, this question about intermittent fasting. Of this person's heard that it's worked for people. What are each of your thoughts about this? And I would just insert in thinking in the whole different age ranges about this, but what do you think of this issue of intermittent fasting?
So I think the question probably came up because we were talking earlier about the importance of eating breakfast and sort of establishing routines as it relates to meals. I think there is a lot of evidence to support intermittent fasting as an effective way to engage in weight loss as an adult, but there is not a lot of evidence to support its safety as a practice in teens and in children. So if an adult was interested in trying it, then you'd have to kind of think through if it was going to work for your lifestyle and if it was something that you could actually maintain, because it does take some discipline in terms of trying to fast for 16 hours a day. However, you know, if it's something that someone is interested in trying, I think there is evidence to show that it can be effective when done properly.
I think, and one thing I learned actually from Dr. Evans is that intermittent fasting means a lot of different things. So there are some variants of this that are what you just said, like restricting for a certain number of hours per day. There are other variants that are, not eating for a day at a time, or severely restricting, for one day and then eating more the next day. So there are lots of different variants, and I think it warrants really being thoughtful about which of those you're pursuing. Because I think some are a little bit more, seem a bit more healthier than others.
Great. And if hopefully, I know we're at the hour, hopefully we have 1 minute left of the technology staying up. Can we finish off talking about family meals and the evidence of the importance of that? Because I think one would think that's easier now that everybody's home, but with this whole theme of this hour of how disruptive this whole experience is around routines, can you just talk about the importance of emphasizing family meals, or is it important? What would each of you like to say about that?
Sure. So I'll just start off, and I think, back to this idea of having routines and planning ahead. I think there's quite a bit of evidence to support that family meals are beneficial to all members of the family, not just to children, but to parents as well. And primarily, family meals add structure and routine to a child's day. So if you're able, I know a lot of us think about family meals as family dinners, because in a typical environment where parents are working outside of the home, that perhaps is the only time of day that everyone overlaps and can sit at a table to enjoy a meal together. But it doesn't have to just be dinner time. So if people find themselves in some non-traditional routines right now, family meals could happen at breakfast, they could happen at lunch. Family meals provide an opportunity to communicate as a family and to check in with each other. I think, we're all spending a lot of time indoors together, but not necessarily spending quality time together. And as we talked about emotional eating earlier and the amount of stress that both parents and kids are under, it's important to have those check-ins and really see how each member of the family is doing as it relates to COVID, as it relates to important life events being canceled or postponed. And another thing about family meals is that they really allow parents to model healthy behaviors. So putting your phone down, leaving your phone away from the table, and engaging in the type of health behaviors you want to see in your children. So if you want to encourage the consumption of fruits and vegetables and whole grains and lean proteins, your child seeing you eating those foods is an effective way to help to instill the importance of those behaviors in them. And we know that family meals are associated with improved diet quality. So to the extent that they're possible and you can plan for them, family meals are really helpful. And one of the things that I found helpful during this pandemic is to make a schedule of each week. We try to do family dinners in our house, not every night, but as many nights as we can. And we allow each person to take a night where they're responsible for coming up with the menu within reason. We're not having, Lucky Charms for dinner. But if we can give that choice again and give voice to our children and our spouses and allow everyone to be part of the decision-making process, it's possible to make family meals a little bit more enjoyable and for people to actually get excited about what's for dinner.
Great. Dr. Jelalian, any last words as we're about to close out?
I just want to highlight something Dr. Evans said, which was non-traditional routines. And I think I want to just emphasize that I think sometimes when we think about routines, we think about what we used to do, perhaps, breakfast at a certain time, lunch at a certain time. I don't think the routines that we're encouraging need to be the ones that we used to be engaged with. I think it's fine to have novel routines, but as long as they're routines.
Great. Well, I want to thank both our panelists for some really excellent advice. Again, thank all of you who participated in the session and put in questions. Amy will say a word as we're coming off, but we'll get this up on our website as soon as we can. It usually takes a week or a little more before that's possible. And we'll also look to get some of these links and other things. But please go to the website to see all of the stuff from the American Academy of Pediatrics.
Yeah, thank you so much, Dr. Vivier, and thank you to our panelists. This was terrific, and thank you to everyone for joining us. As Dr. Vivier said, we have a lot of great resources on our website, so please do visit us. It's www.brown.edu Hassenfeld. We have a lot of great resources there. And if there's anything that you want us to talk about in a future webinar, please feel free to email us as well. Thank you so much, everyone. Have a great day.
Thanks, everyone.
Thank you.